So as a third scenario, we'll look at the intersection of health and housing. So in this example, let's suppose that you're a health system or hospital in the Sacramento area that is seeking to assess the need for investments, as well as identify potential partners in upstream social determinants of health, such as housing. So we'll go back here to PolicyMap. So we'll start here by zooming to Sacramento, California. And now in order to find the hospital that I'm interested in, I'll add the hospital data to the map. Oops. And now I can just search for the hospital that I'm interested in here. So it takes me right there. Here it's a short-term hospital in Sacramento called Sutter Medical Center. And then now that we're looking at the hospital, in order to get a sense of housing needs in that area, you'll see that we have a housing menu here. This offers quite a wide range of possibilities in terms of examining the housing market and any potential concerns in the area around the hospital. So when I click on housing, you'll see we have data around home sales. You can see how housing prices are changing, home values, median rent. We have the residential vacancy, data around home ownership and rentership, subsidized households, and here's cost burdens. So if, say, for example, we know that a lot of hospital employees are renters in the area, we might want to pay special attention to renter housing concerns. So we can take a look at where renters are cost burdened, or where basically that means where they're spending more than 30% of their income on housing. So here, the darker areas are areas where a higher percent of renters are spending more than 30% of their income on housing. So we can see a very dark block group south of the hospital here. When I click on it, I can see that in this particular block group, around 63% of renters are cost burdened, so it's very high. So this might be a potential area of concern or area of focus for the hospital. And then you might want to be able to get a sense of the availability of rental housing in the area. So we can do that by adding some more housing data to the map to get a sense of, say, for example, where all the current subsidized housing is located. Let's zoom in a little bit and add HUD public housing locations to the map. And I will go ahead and add HUD multifamily properties to the map as well. And then I'll add the low-income housing tax credit locations. So now I can see where, in relation to the hospital, the existing subsidized housing locations are. In order to do some more kind of analysis, I'll create a custom region or a target area within a certain radius of the hospital, just so we're able to kind of get a sense of which area around the hospital we're really trying to analyze. So I'll go ahead and go down here to custom regions again, create a custom region, a radius region. And so let's say we want to look at within 3/4 of a mile of the hospital. We want that to be our area of analysis. So I'll create that radius region. We'll call the Sutter Medical Center community here. So this gives us a sense of which kind of boundary we're most interested in. So then now we could do what we did before, click on the icon, and this would let us query a list of all of the current subsidized housing that exists in the area. If we wanted to be able to get a downloadable list of HUD public housing or the multifamily properties that are currently in the area, we could do that. But it also gives us a sense of just where geographically these assets are located. And you can see that in this area that we had already identified with a high percent of cost burden renters, we're not seeing any of those locations. So this might be an area that we want to consider focusing on. So as a potential next step, since most hospitals are not in the business of developing housing, a next logical step might be to identify potential partners to work with on this, or to get a sense of whether there's current developments already in the works in this area. So we can do that. I'll get rid of the housing locations for a moment. And now we could start thinking from a lens of identifying partners. So we could maybe want to add the certified CDFI locations to the map, so we can get a sense of any existing CDFIs or community development financial institutions that might be in our area that we could potentially partner with, whether for financing or for development. So we can see here that we have Opening Doors Inc., which is a loan fund, and we get some contact information, the website for the CDFI. We might also want to look at housing-related nonprofits, which we can do as well under quality of life. We can add nonprofit locations. You'll see there's quite a few everywhere, but we can filter out the ones that are related to housing. So here there's a housing and shelter option. So now when I select those, I can see housing and shelter related nonprofits. In this, again, if I click on one, I'll be able to see more information about that. And so now we've gotten a start to identifying some of the potential partners that we should probably be in contact with about our housing related efforts in this area. And again, if you click on here, we'd be able to download lists of those types of assets.